Hello everyone, my name is Mia Ryman, and today I'm going to be discussing some of the important advocacy issues that the advanced practice nurse faces in the repeal and change of the Affordable Care Act. So first, let's take a look at the Affordable Care Act. The Affordable Care Act is also known as the Patient Protection and Affordable Care Act, PPACA, which is its official name. It's also been known as the ACA or even Obamacare. This act was enacted in March of 2010 and has had three primary goals. And those three primary goals were to make affordable health insurance available to more people. Another one was expanding the Medicaid program to cover all adults below 134% of the federal poverty line and to support innovative medical care delivery systems. To make insurance more available to all, the ACA focused on increasing access and affordability of health care. It expanded public and private insurance coverage and worked towards reducing the costs through subsidies, mandates, as well as the insurance exchange program. To ensure availability, it increased coverage as well as affordability. Other aspects that the ACA covered focused on ensuring that insurance premiums would not increase based on pre-existing conditions, excluding tobacco use, or even gender. Young adults could be covered on their parents' insurance until the age of 26 years old, and preventative services were to be more accessible with little to no cost. These are just a few of the subparts of the section improving coverage. I have listed below and in the references the actual Affordable Care Act references as a reference if you'd like to review it. But those are just some of the ways that it worked to make insurance more available. So as future advanced practice nurses, I believe our first priority for advocacy is to our patients and their access to health care, insurance coverage, and financial assistance when needed. The implications of practice regarding advocacy issues are that if we as nurse leaders do not protect our patients, their access to insurance, and we're essentially doing them a disservice. As nurses, we hold ourselves with pride in providing high-quality, holistic patient care. Therefore, advocacy for our patients' access to health care, insurance, and financial assistance is essential. Because if that patient's financial needs are not met, these needs are at the core of their holistic care, and it may be a root of anxiety, depression, and even poor health outcomes. Therefore, the top three aspects of the Affordable Care Act that I feel should be advocated for with the new healthcare repeal and to ensure that patients have continued coverage and no increase in cost related to pre-existing conditions and or gender. I feel that young adults should continue to be covered by their parents' insurance plans until they're 26. And finally, I feel that there should be a continued focus on preventative care. All in all, we as nursing leaders and future primary care providers should be concerned with our patients' well-being overall, their access to health care, and their financial abilities. Finally, I wanted to just go over some steps for advocacy. I read this great article, The ABCs of Effective Advocacy. And these steps are going to be essential for us as future nurse practitioners. This article provided great steps and information how to become an advocate. And the first step is to be involved. We can connect with nursing organizations, which can help us build networks and stay informed. It's important for us to continue to share information with our colleagues, especially as nurse leaders, and you can even kind of light a fire in others if you're talking about these issues. Another step is to vote knowledgeably. We can write or call and communicate with our representatives on the local, state, and even federal level. And finally, it's essential that we communicate effectively, efficiently, and keep our patient in the center of the focus, because that's who we're really advocating for. Finally, I leave you this quote by Plato. Those who refuse to participate in politics shall be governed by their inferiors. And I felt this quote really rings true with the importance of advocacy within the advanced practice nurse profession. And it's just something to kind of keep in mind. So thank you for listening to my presentation, and I look forward to the discussion.